Okay, let's get started. Good afternoon. My name is Ani Pagosian, and I'm the Economic Development Coordinator here with the City of Glendale's Economic Development Division. Thank you all for joining us for our virtual Tech on Tap event featured by the City of Glendale and Children's Hospital Los Angeles KidsX Accelerator. Today, you will hear from Donna Lee, CEO and founder of Wander Health, and Eric Cardenas, CEO and co-founder of Zacalo Health, as they speak about their journey as founders and their decision to act on an idea and start a startup during this interactive fireside chat, which will be moderated by David Delgado from KidsX. We highly encourage you all to ask questions in our Q&A chat box after the presentation. Thank you. David?
Thank you so much. Hello, everyone. Thanks for giving up some of your Wednesday to join us. We're very happy to be putting on this presentation in collaboration with the City of Glendale. So I wanted to give an invitation actually to jump in with questions as the conversation is happening. You know, this is set up to be a fairly informal event where we can really learn as a community from some founders who have paved the way as far as starting startups go, to really give us insight into what is involved in that process. How do you go from having just an idea to having a company that is out in the public and thriving and giving a product that people can use? So hopefully some of you have ideas yourselves that you are looking to either start a startup with or looking for collaboration. And thank you to the City of Glendale for creating this dynamic space that can foster innovation and foster creativity like this. So I'm going to share a brief presentation before we jump into the discussion with our panelists for today. So as Ani mentioned, I'm from a group called KidsX, which is part of the Children's Hospital of Los Angeles. And we are a group that's dedicated to really bringing innovation and catalyzing innovation to pediatric hospitals all around the world. So my slides are not advancing. I wanted to give a quick overview before we jump into the topic for today. So KidsX is a global leader in accelerating digital health innovation. And we really focus on pediatrics as the core focus of what we do. We are run by a pediatrics hospital for pediatrics hospitals. And we focus in on digital health as the pathway to solving some of the biggest cares in pediatric healthcare delivery. So we're anchored by a consortium of hospitals that spans the globe, with the majority of them being here in the United States. But we have 36 different hospitals that make up our member consortium and drive this innovation space that we are able to cultivate. And we do it through a variety of programs. We have our KidsX Accelerators, which are multi-week programs that are designed to help early stage companies really get a good foothold within the pediatric healthcare space. And we do that, of course, in collaboration with our hospitals. And if there's a problem that can't be solved by an existing company, then we have a new partnership with Redesign Health, which really allows hospitals to design and create solutions that have white space opportunities. And of course, we have our KidsX community of hospitals. And so we share best practices, we have collective brainstorming, and we collaborate really as a force that is stronger than any one of our individual voices to push innovation forward and really make it so that we can care for children the best that all of us can collectively care for children. We've been able to run, with the partnership of the City of Glendale, we've been able to run 5 accelerators so far, and we're actually just about to launch our 6th accelerator this year in May. And we've had the opportunity to collaborate with AWS, Press Ganey, and then we've had 2 of our own healthcare accelerators. Overall, we've graduated almost 50 different startups. 59% of them have had BIPOC founders, and we're very proud that 45% have been female founders as well. So not only bringing a diversity of thought and concept to these hospitals, but bringing a diversity in thought and representation. Of the startups that have been able to go through our accelerators, 32 different unique hospitals have partnered and piloted with them, which has translated to 54 active or completed pilots. So our accelerators really have succeeded in their goal of exposing and accelerating adoption of some of these fantastic solutions that you see from the companies with the logos on the screen. So with that very brief highlight, we'll jump into our main topic for today, which is taking the leap of faith and transitioning your product, your idea from just something that you kind of have in the back of your head to something that is out there in the world. We're joined by two fantastic founders today. As was mentioned, Annalie is the founder of Wander Health. So Dana is the CEO and founder of Wander Health, which is a tech concierge platform that connects travelers while abroad to local healthcare providers. She previously was on the founding team and head of operations at KidsX. You had the privilege of working with her before, and is one of the world's leading digital health ecosystems. Prior to this role, she was involved in building payment models for ECG management consultants and co-founded a community ventures program at Dell Medical School. She has a master's of health administration from Columbia University and a bachelor of business administration in finance from the University of Texas at Austin. She was recently selected as a Forbes 30 under 30 in healthcare and has given some fantastic TEDx presentations as well. We're also joined by Eric Cardenas, who is a healthcare tech executive with more than 20 years of leadership experience. In August of 21, he founded Zocalo Health, which is a healthcare service designed for the Latino patient using primary care model that blends tradition with innovation and prioritizes trusting relationships between care teams and patients. Before founding Zocalo Health, he served as a founding team member and a senior leader at Amazon Care, which he led, where he led several technical teams. Eric was a key contributor to Amazon's COVID-19 response and a global testing initiative. He's a seasoned entrepreneur and a health system leader, and he previously managed health IT portfolios at Tenet Health and led founding operations and technology at Everywell. He currently sits on the Rogers Behavioral Health Board of Directors, and in October 2020, he was selected as one of Business Insider's 30 under 40, who is working to transform U.S. healthcare. Eric is passionate about delivering customer-obsessed healthcare solutions to fulfill his vision of a more personal and equitable healthcare system. While not working to grow Zocalo Health, he enjoys spending time with his family, exploring the outdoors, and playing sports. Welcome to both of you. Thank you so much for your dedication to this space, first and foremost. It's been fantastic to watch your success and to watch everything that you've been able to do. And thank you for giving us some of your time today. So how I have this session set up, we'll do a little bit of a deep dive into each one of your companies, each one of your solutions, learn a little bit more about what it does, and then learn about what that process was like of turning that company from an idea, from a concept to something concrete. And then we will have some general questions that both of you can answer. And at this point, I'll invite it up to invite others from the audience to jump in with questions as well. So Eric, we'll start with you. So take us through, first of all, a little bit more into Zocalo Health. Give us a description of what you guys do at this point.
Yeah, thanks, David, Dana, Ani, everybody for just giving me this opportunity to share a little bit about the story and just sharing the space. Yeah, I'll share just briefly. Zocalo Health is a relatively new company. We're a seed stage venture-backed company that we launched in August of 2021. So Marissa, my co-founder, and I both met at Amazon, and we both had a lot of the same shared lived experiences when it came to navigating a very complex one-size-fits-all healthcare system for our Latino families and communities. And so we decided to start a company that basically provides a new experience to primary care that is very focused on meeting the cultural, the healthcare and social needs of the Latino community. It's virtual first, and we're available in California and in Texas, and are really excited just about trying to improve the experience for our families and our communities.
Thank you very much. Dan, I'll hand it over to you as well. Could you just give us an understanding of what is Wander Health and where you guys are right now?
Yeah. So Wander Health is a medical concierge service. We are tech enabled, and what we do is we help travelers get access to healthcare. Currently a bootstrap company, so really, really early. And what we are focused on is helping people get same day, next day medication delivery, along with same day, next day urgent care appointments when they are in a different country.
Perfect, thank you. So I invited both of you in because, you know, you're in different stages of early stage. So this is definitely still a fresh conversation for both of you. Obviously, then it's a little bit more recent for you, as you just recently came out of stealth. And Eric, you've been doing this for at least a few years now. So you'll be able to look at it with a little bit more hindsight and a little bit more of kind of a broader worldview. So Eric, again, we'll start with you. So take us through that decision to start Socolo. You mentioned that you were at Amazon. You mentioned you were there with your co-founder. So let's start at the beginning. So what was it about what you were seeing? What was it about what you were doing that kind of inspired you to change?
Yeah, that's a good question. And I think when it comes to the answer, you know, I just want to highlight that I'm a little bit of an older entrepreneur. I'm 41 years old. This is probably the fourth startup that I've been a part of. And this one is probably, I hope that at least the response is one that will resonate with some other aspiring founders that might be in attendance. But basically what it boiled down to is, you know, I've been in healthcare for 20 some odd years. And while the most recent job I had prior to Socolo Health was with Amazon, Amazon gave me a lot of experience about how to build and how to really apply a methodology to like problems, right? And how to solve some of these problems. And for me, it was really what it comes down to. The driver was, you know, it was the right market conditions, the certain discussions that, you know, were happening in healthcare, combined with like passion and purpose. You can imagine the last few years that I've been working for some startups. We had built some pretty innovative products around lab testing at Everlywell. At Amazon Care, we had built this amazing experience for our corporate employees. And as a Latino, you know, my parents are immigrants from Mexico. I realized that my 20 plus years of working in healthcare, none of the things that I had built were for my community, were for my family, for my mom, my brother, my sister. And it was at that point in time that I realized, okay, like, is there an opportunity here for us to build something new? And I think when I think back to the experience at Amazon, one of the things that I learned at Amazon was to think big and not be intimidated by thinking big and being bold with your ideas. And it was then at that point that I started to really kind of think about, you know, an opportunity to build something great. Have conversations with investors, you know, met an amazing co-founder like Marissa, and got to a point where I felt like, you know, all the pieces are aligning. And I think this is going to be one where I can really, you know, deliver on this passion, this purpose to really make a change within the Latino community that I've been a part of since I grew up, right? So it was definitely just the right market, and I'm happy to go into more details, David, as you see fit. But it was certainly just the right conditions. People were starting to talk about health equity. There was a lot of discussion around value-based care, and then telemedicine during the pandemic was one of those things that a lot of people weren't paying attention to prior to that. Combined with a good economy, you know, a lot of venture capital in 2021. That really kind of made everything align and make it super enticing for me to decide that I was going to leave a really comfortable job at Amazon and be a glutton for punishment as an entrepreneur.
Yeah, so I'm kind of along those lines. You know, there's a difference between seeing an opportunity for something and seizing that opportunity. And so, you know, I'm curious if there was a single point that you could point back to where it changed from like, hey, someone could do this to, hey, I'm going to do this. You know, I'm going to make this something that I dedicate my life to. Was there a conversation? Was it something that you saw? Or was it just kind of a slow buildup of all these forces that kind of ended up pushing you in that direction?
Yeah, it was definitely a slow buildup. I mean, there's definitely things that you know, you come across in conversations with other really creative people that sometimes inspire you to kind of connect certain dots that other people are. But I'll tell you that just being around this space for a long time, you know, ideas are cheap, right? There's always going to be ideas that you come up with. I think, you know, just anecdotally, there's always like, if you talk to entrepreneurs, ask them to look at their GoDaddy accounts, because entrepreneurs will always buy domains for ideas, thinking like, one day I'm going to get to this thing. And you'll always see that people have tons of ideas, but it's not until you start to really think about those ideas and really kind of think through it, and also not fall in love too much with the idea, because sometimes that's also like a sin, right? Like falling in love with an idea and not being, basically not being willing to experiment and do the research to validate, your initial hypothesis and the problem statement and all those things. I think for me, it was, I was coming off of this role at Amazon, was having already discussions with investors, and I was already understanding like what investors were investing in at that time. Like what were the topics that were really of interest? What were these discussions around health equity initiatives? What was, how is telemedicine really kind of coming together? And is it going to be something that's going to be short-lived? And those are the things that really were the motivators, right? And once I started to write this down, put this on paper, I met, Marissa and I had already met at Amazon, and, Marissa had a very complementary skill set to my skill set. It just, things came together very beautifully. And I think that's where I felt that when it comes to risk, all the things that I think are easy things to sort of miss at the very beginning, I was able to address and really feel comfortable that we were mitigating as much of the early dumb risk as much as possible and putting ourselves in a position to at least give this a fair shot and get started with a good, strong foundation.
Thank you. I have so many follow-up questions based upon that, but I want to go over to Wander Health and hear that story as well before we jump into kind of the shared questions. So Dana, do you want to give us a little bit of kind of the similar view? How did you first start thinking about a concierge travel service that was digital forward? What was that process like for you?
Yeah. So obviously I was at KidsX before I left for this role, and I had an opportunity to work with so many different startups, so many different founders. And I loved supporting all the companies and help others build out their dreams. And then also be able to really think about like how we can tackle like business challenges that each startup face. It's like somewhat similar, but like in a different context. So I started to really realize that I love going from 0 to 1. And I knew and had the confidence that I had the foundation to build my own company after building so many of these innovation challenges and accelerators through KidsX, along with all my previous experiences as well, that I thought about, if I wanted to build a company, what would I want to solve? Because I think if like years back, I didn't even think that I would even be in this position of like wanting to ever start my own company, but starting to learn about it more, being just exposed to so many incredible entrepreneurs. I had that bug and I wanted to get at it. And so, so last year I took over 50 flights and I traveled pretty frequently too growing up for long periods of time. And somehow every single international trip, I had a healthcare issue that had popped up, whether it was minor or major or whatever that may be. It could be like just having to go to the pharmacy and trying to communicate with the pharmacist there to buy over-the-counter pills because it was just in a different language or a different brand that I wasn't familiar with, or even having to think about what do I do when I have food poisoning? Like how, like, anyone who's had food poisoning, it's the worst. And especially while you're traveling and you're only there for a certain amount of time, you want to make sure that you're maximize you being on the trip rather than you feeling sick. So, very common things. And in each country that I went to, I couldn't find a place, like a centralized place to help me with all these like needs that I felt I knew that were common because there were other people that had experienced this. So I went down like a deep like rabbit hole on Google and I couldn't find anything. And I also quickly realized that, again, like 20 million other Americans who travel every year have the same issues. And so I knew that it was like a big enough market. And instead of me complaining, I wanted to do something about it because I wasn't going to stop traveling and people aren't going to stop thinking about their healthcare. So I wanted to really dive a little bit deeper on like, why I should start doing this. So yeah, that was kind of the origin story.
So that's interesting. I actually wasn't aware that you were looking for a solution first. You had the bug, you knew that you had kind of the skill set to do this early stage startup and go from 0 to 1, as you said that. I love that. How many ideas did you buy the domain for? I was talking about before you landed on this as the solution that actually had that there was a there.
Yeah, so I love what Eric mentioned about not falling in love with your idea, because that's exactly how I felt when I first quit KidsX, because I was like in love with the idea that I had, but I quickly realized that that wasn't the idea that I'm actually going forward with. It was what I constantly had to do was just like test a lot of assumptions, talk to like my potential users, other travelers, and really understand what their pain points are. So I think I like created this chart of like all my like ideas solving the same issue. And I think I landed with, 7 different ideas, 7 iterations of this idea. And I finally landed on the one that I'm going forward with, but it took some time. It was intense of just customer interviews or potential customer interviews for about like a month of like nonstop doing that. And now I'm feeling that much more confident on knowing like this is like the idea that will do well.
And how involved, you said a month of customer interviews. I'm assuming that was just to kind of validate that idea. How involved is the end user, the customer, in the process going forward? You've come out of stealth, everything like that, but I guess, are you set on the idea and that's it? Cool, it's in stone going forward. What does that look like?
Yeah. So as you mentioned, I just came out of stealth. So my next step is actually launching my beta and testing it. And so until I have it in the market, I won't have enough data to show that it is like truly like validated or there's a true product market fit. I can do all the research online. I can give you all the stats. I can talk to people all day, but until somebody like puts their credit card in and say, yes, like this is like something that I want to buy, and this is something that I believe in the solution and it's going to help me, like there's an actual impact or outcome afterwards. I know that my job isn't necessarily done yet for the ideation stage. Yeah, exactly. Just yet. So yeah, I mean, the thing is that like I'm in love with the problem, not necessarily the solution. And so I'm open to continuing to make sure that I'm serving the needs of international travelers and people who are, who have to really think about their health even more. So especially if you have chronic conditions too. So yeah, that's kind of where I'm currently at.
Eric, I see you nodding your head a lot, especially with that falling in love with the problem, not the solution. When you first had your idea, or I should say, when you first were aware of the opportunity and kind of the space that was there for something that maybe was niche to the Latino market, but overall just an improvement on the way that telehealth was being handled in primary care settings, did you have a concept for what is the current version of Zocalo?
Yeah, I think it wasn't so much that we had a concept. Like the unique thing about this particular company when we started this company was that we did start with this like think big idea. We wrote this like very Amazon inspired document, which was a press release and an FAQ. And it was for like what Zocalo could be 5 years from now. And that's what we felt was like the way to get the attention of investors early on so that they understood what it was that we were trying to solve for. How this impacted the community, how this impacted the healthcare system, like all the stakeholders that were involved. And once we convinced them, that was great. It was in that now how do you unpack that and then focus on that crawl before you can get to that run, which was that 5-year vision. So what is really difficult and what resonates with me here is that you want to start thinking about how you can, in a very scrappy way, whether you have funding or not, validate, and get to that product market fit that was just mentioned. And it's not just product market fit. The other thing I want to mention is it's also about founder market fit. I think one of the things that people don't ever tell you is that, there are tons of problems out there to solve, but there is a certain, I think one thing I wish I would have learned 10 years ago is that not every problem is yours to solve, right? And so making sure that, you know, in our example with self-vital health, we had a very front row seat to a lot of the problems growing up, having access to, you know, very poor healthcare experiences. And the instant validation for us was that, you know, while I grew up in inner city Houston and Marissa grew up in rural New Mexico, those problems were much the same. So it wasn't a Houston problem. It was just like, this is what the healthcare system looks like for our community. And we had to basically do a lot of research. We spent hours and hours and hours talking to people, trying to validate the problem, get a lot of the qualitative data in before we even started to think about a solution, because we wanted to just have a really good understanding of the problem, what solutions existed, and then start to develop a hypothesis around what we thought we could do. Ultimately, it did lead us to thinking, okay, well, primary care is the sort of the gate to all this, all these expenses in healthcare. And that is the one area where there are not enough doctors to serve the community. There was data that we shared with people around just how big of an impact, or just how many providers are missing in the Latino community. The fact that, you know, when you look at countywide level data, you're like, okay, there's this many doctors for this many residents, but then in the Latino zip codes, it was just out of control. And we realized, okay, our first bet is going to be just proving that we can engage, and can we like mark that as the crawl to getting to that 5-year plan. And so that's ultimately like how we approach this problem, is to start with the think big and then unpack it to get down to the smallest, most testable thing that you can do, and test quickly, fail fast, not fail fast and like hurting patients, but just like testing certain hypotheses. And if you're not getting the data that you expected, like move on, test something else. And I just can't stress how important it is for people to do that, to spend the time gathering the data and letting the data pull you in the right direction.
How close are you right now, 3 years in, or 2.5 years in maybe?
Almost 2 years. It'll be 2 years in August.
Oh yeah. All right. Sorry. Forgive my math.
Right. It feels like it though. I feel like I've been at this for like 12 years already, but yeah.
Yeah. Oh, I'm sure. How close are you now to your envisioned 5-year milestones?
Yeah. You know, the market, the economy hasn't been really helpful this year. I think it's important for any aspiring entrepreneur to also recognize that, you know, the macroeconomic, you know, situation, like that impacts how people invest, that impacts how people buy, that impacts a lot of things that even if you're thinking about a small business, getting started is difficult. So, you know, we took this approach that, you know, one of the things that I recognized was that there were a lot of direct-to-consumer businesses out there, and a lot of those businesses were growing at whatever cost, right? Customer acquisition costs were extremely high, and you know, that may have worked for a little bit. And then you saw some companies, you know, it's not just important to look at the winners, but it's also to look at the companies that have also shut down, and like why. And what we noticed were that there were companies that would kind of get into this like revolving door of death, where if they couldn't acquire customers directly through D2C channels, they're like, okay, well, let's go to health plans. And then when they realized health plans sales cycles were long, then there was like, well, let's go to employers. And then when they realized that employers have already made, you know, health plan benefit decisions 3 years down the road, they're like, well, let's go back to consumers. So we knew that we didn't want to get stuck there. We wanted to make sure that we had a very clear roadmap for our direct-to-consumer approach, that we weren't trying to get to 1 million customers. We were just trying to get to a few hundred that we could really provide good care, go really deep, and then use that to negotiate health plan discussions. And so we've managed to successfully kind of do phase one, which was launched, prove to people that one, we can launch and deliver care safely, and use the initial data to start that year-long process of working with health plans. And so we're about halfway through that. Things are looking really well. And hopefully, if those things continue to progress, we'll get it to that big milestone, which is to then go and raise a subsequent round of funding, which would be a Series A for us.
Fantastic. You mentioned something that's just so crucial, I think, to kind of the strategy of how you set things up. And it seems like it worked tremendously well in your guys' favor. But, you know, trying to get as much data as possible, regardless of kind of the quality of that data, versus really focusing in on what you're trying to measure, what the impact you're having, and maybe a smaller data size, but real rich data. How did you come to that conclusion? Is that something that you've always had? I don't know, is that baked into the Amazon culture?
That is baked into the Amazon culture. But even like with startups that I worked for before, like everyone had like a KPI dashboard, and you would Google, what KPIs do I measure? And you know, you're like, cool, let me go ahead and measure those. And for some businesses, they're super relevant. For some, they're not. I definitely learned at Amazon that, you know, you measure everything and follow the data and let the data sort of inform your decisions and the experiments that you want to run next. I think that's one of the best ways to, again, manage risk, because at the end of the day, what it comes down to is really just managing risk as best as possible. I think it's really important to understand what it is that you're trying to do. And so goal setting is really important. It doesn't matter the size of the company, whether it's a large corporation or a 3-person startup. Define your goals, and then define key performance indicators that measure whether you're getting to those goals or not. And you need to have goals that are really flexible and squishy. But again, it's capturing data that's really relevant towards that. And whether it's like, what is the goal for today? What's the goal for this week? What's the goal for this month or this quarter? Being able to define those and then deciding whether you're meeting them or not is really the most important advice that I could give anybody at this early stage.
That's great. Thank you. Then I have a question for you around kind of holding on to an idea versus talking to people about it. I've talked to a number of, whether it's peers of mine or you know, would-be founders that kind of missed the mark or something, or it's like, oh yeah, I didn't want to tell anyone about my idea because I was afraid someone was going to steal it. But then there are some cases where that does actually happen. So I'm curious on the approach that you took. Did you talk to people about your idea, or did you hold it close to your chest until you had something that actually was built?
So same thing as what Eric is saying, ideas are cheap. Like, you know, I think that there are, you know, you don't want to completely tell everyone your secret sauce. And you also want to be sure who you're talking to too. Like, make sure that you frame the what you're saying to that individual or that person. But I went the approach of like just talking about my idea even before I even came out of stealth, because I felt that if me talking to this person gave me the opportunity of them hearing something that they might know somebody that could help, or they might have a resource that might be helpful for my process. That was what I was betting on too, along with just getting some feedback from people. What also was really helpful too when talking about my idea, there's like the lens of like somebody who could potentially be like a mentor or, you know, an industry contact, or that's kind of like different in terms of like how I talk to people about my idea. But the lens of if I was talking to a potential user, I actually try to hold back on my idea and not say much about it, but ask questions that are like surround kind of like the problem that they may face that I'm trying to tackle. So because I'm trying to like really be innovative in travel health, I asked like, you know, like, have you gotten sick while you've traveled, and what have you done? I understood what their current situation is rather than me pitching all the time. I actually learned more that way than me, again, shoving my idea down somebody's throat. Maybe they're going to say, I love it, it's great, because everyone is just nice. And sometimes I don't need nice. I need honesty, and I need what's real, and I need what's what people would people actually want this if the solution exists. So I think it's just framing depending on who you're talking to. And I went on the side of being more transparent rather than keeping it like tight-lipped.
Eric, I see you just took yourself off mute. You have thoughts?
Yeah. No, I mean, I think we covered it pretty well. Nothing really to add, David. I'm good.
Okay. Sounds good. I'm curious about, who you mentioned. Some people are just nice. Some people, are giving more product feedback or problem feedback, versus some people are really giving thoughtful insight into the industry or into the space. How did you select which was which? How did you select which people were, could be access to different areas that you didn't have exposure to before, versus someone who just, had good connections and traveled a lot?
Yeah. Typically I feel like my industry contacts were people I knew on a professional level. And if I knew that they traveled a lot, I would go on the angle of them being a potential user, and chatting to them like that. But if I just didn't know what their travel habits were, or if they had a chronic condition, or if anything like that happened, I would just err on the side of like them being like an industry contact. But for the individuals that I'm just meeting out and about, I went on the side of, I'm just going to assume that you are, you travel internationally, and maybe it's not often, but maybe, you've done it before, and like what has happened, and understanding what has happened to them in the past rather than what could happen is also a good differentiator too, because everyone could be like, yeah, I would use that, or I could see myself doing that, or all that stuff. But it's been more helpful to understand people's current habits or previous habits, because it actually happened rather than it being a what if scenario.
Makes sense. Yeah, I'm curious. So one of the other reasons why I invited both of you is because you have different perspectives in kind of going at it alone versus joining up with someone from the very beginning and being a co-founder. And I imagine some of that is just the circumstance in which this idea comes up. But there's sometimes also some strategy behind it. So, Eric, I guess I'll start with you as a co-founder. Is there anything that you and Marissa talked about that gave you kind of confidence that she was someone not just to share the idea with and could help guide you in your thinking, but being a co-founder is a significant undertaking. So what was that process of finding that business partner?
I made a very terrible mistake early on in my entrepreneurial journey, where I brought on people because I felt I needed validation. Right? I had brought on two co-founders that I felt just strengthened the company profile. And while that can be valuable at the right time, I did it by undercutting kind of like my own value and what I felt I could bring to just, taking the risk and leaving the job and not taking on pay for a few months. Or kind of like, those are real concrete sacrifices that people have to make. And so when I knew that I was going to want to do something else, and that I was interested in exploring new ideas, I'll be honest, it just came down to the fact that I got to know Marissa for a couple of years and work with her and really get to know her and see her perform. And when I was like, yeah, like this is somebody who I could go into business with. And, it's business first, right? Like that's what is really important for a lot of people. Like you have to just understand that like it's business first. And like, sometimes it's hard to commingle friendships and business relationships, because undoubtedly some things do, go south and it could be really hard. It could be really stressful. But this is where, talking about the personal like mission and the desire to drive impact, where I felt like that didn't matter as much. Like I wanted to make sure that was something that we really sort of built into this relationship. And so the fact that like she has a family, I have a family, we support each other. We're far away from home. It was just a lot of the things matched up, and it came down to, one, we just had complementary skill sets. Two, we had very similar experiences, although just like on different sides of sort of the healthcare sector. And at the same time, there was this thing where we were both really aligned with also saying like, hey, we're Latinos, we're founders, and we deserve just as much opportunity as anybody else. And we filled that role, I think, pretty well. And it definitely, I feel like we made the right decisions. We're definitely still to this day, like we've gotten through a lot of hard times. We had to deal with the whole Silicon Valley Bank thing the other week. And those things kind of test you. And I'm still really proud of the opportunity to work with her every day. So when you find somebody who you can trust, definitely, build those relationships and feel good about it.
And same question to you, Dana. You're going at it alone right now. Is there, I don't know, I guess, what's the thinking behind that? Is there potential, like if the right person comes along, would you be open to kind of sharing this idea? What's your thinking there?
Yeah. Yes. If the right person came along, I would definitely be open to having a co-founder. At the moment, I went into it being a solo founder because I've done co-founder dating in the sense of, looked at my network, chatted with people, talked to, or even like joined a lot of different platforms where people try to, like, you meet other people that are interested in the same space or have complementary skill sets to you. And nothing has stuck just yet. And I told myself, I want to solve this problem and I can do it as long as I can. And I know that, I feel like confident that I'm able to execute as much as I can, to a point where I'm starting to learn that maybe there's certain things that I need in a co-founder. And rather than me guessing and assuming, oh yeah, I need a technical co-founder like every other person because I'm on the business side. It's starting, like, I'm starting to learn, like, maybe it's someone who's like more clinical, because I'm building a platform that really thinks about, like, we really have to think about like different, or triage and different clinical pathways too. But I wouldn't have known that until I started building and started to like go through my company and start this up. So yes, open to it. And I think that I'm just, continuing to move forward and continue to be open to meeting other people, but it definitely is hard and it's a challenge if I've never worked with them before. So even if I did find somebody that fit my needs and had the same interests and was willing to, give up their life for the next 10 years to this, then I would have to also test it. Like, you have to do projects with them for X number of months to see how you work well with each other. I don't know how you test a crisis. I'm
sure they would come up.
Maybe scenario testing. I don't know. But yeah, so that's kind of where I'm currently at in my thinking.
Great. Thank you. I have definitely some more questions, but I want to make sure that we open it up to the people that are here, just in case anyone has anything that they've seen and want to follow up on, or just general questions for our panelists today. Feel free to unmute yourself. I see something in the chat from Carson Folk. He said, going off the gathering data, where was the cutoff for y'all in terms of having enough data in order to start facilitating the idea? Or is this just up to risk tolerance?
I'll jump in. One, I don't think there's ever a cutoff. I think that, it's really, Dana talked about a feedback loop, like getting information, like getting data from your customers, even if it's before you start or once you've already started to deliver your product or your service. The importance of just gathering data, like that's a never-ending task. But you shouldn't just act off of the data alone, right? Like you still have to, have good instincts. You have to be able to sort of decipher what that data is telling you and develop, your own hypothesis. And yeah, it does come down to risk. Like it depends on what it is that you're trying to answer or what decision it is that you're trying to make. I personally have a lot of tolerance for trying things because I think that's how you end up innovating. Right. If you look at the data and the data just tells you to build, something faster, you're just going to build something faster and not think about, well, maybe should I go upstream a little bit and just build something completely new that doesn't have performance as an issue, right? Mm-hmm. And so it's being able to really just establish the appropriate mechanisms to gather the data that feeds you the information that you combine with your own personal judgment, your own personal instincts, or that of the people around you. I think one thing we haven't talked about is just like the importance of having just a good, strong network, mentors, advisors, investors, et cetera, that can help you sort of button up that data and help you kind of pressure test these ideas so that you can go ahead and give those experiments a try.
Amazing. Okay, cool. Thank you.
You're welcome.
Any other questions?
I guess if no one else has a question, the other thing that I was wondering is some people talked about having confidence within yourself and your ideas. I think Dana talked a bit about that. How exactly did you cultivate that, I guess, first? And then, Eric, I think your situation was more like brick by brick building for Zocalo. Like, would you say that was your path as well? Dana having, confidence initially and then you building. Yeah, I guess two-pronged.
I mean, look, I'll tell you, I felt, so my journey is a little different. Like I didn't get my undergrad until I was an adult. I had a lot of like insecurities and like imposter syndrome for a large part of my career. I ended up, I think the real breakthrough for me was just, like, it was funny. There was an article that came out and I remember I couldn't share details about this Amazon project I was on. So I just like filibustered the whole interview by talking about myself. And then they published it. And I was like, crap, like my business is now on the street. And I thought that I was going to get fired because in this interview, I admitted that I had not finished, that I got kicked out of school and that I didn't finish until I was an adult. And that ended up being my strength. And so I think that's where, for me personally, I realized that, man, I should probably have a little bit more confidence and just be comfortable being who I am. And now I'm building a company that allows me to do that. Like there's code switching that happens in the corporate world, right? Like Eric at home and Eric at work, we're very different people. But this is the first time where I get to be me. And I'm building for my community who respects me and appreciates me, who probably has a lot of people who struggled with school and, getting kicked out and all these things. And so this is where, you got to just get those insecurities and just like face them and like find who you are, what your core competencies are, and just go. And then if you find people who are allies, who are either co-founders or teammates or whatever, that really support that, like let them be part of your story and build on that narrative so that you and the thing that you're building become the center of the conversation and that there is no sort of imposter syndrome. And so that for me is one thing. I don't know if that's exactly the question you had, but I'm just sharing with you my personal story in that, I was probably at the top of my career and still had a lot of insecurities, and you just got to figure out how to overcome them. And once you do, you'll realize that you can do a lot.
I think chiming in on that, well, Eric, you've done so much with your life also, I feel that like I built my confidence because like, I know that I'm going to get it done. Like, I know failure is not an option. Like, so whatever I'm putting my like head to and whatever I'm deciding to do, it's going to get done and it's going to be successful. And it's one of those things where I'm just really, I've looked at my past history, like everything I have accomplished has been great. So why not this new challenge that I'm deciding to go after and facing? Like, why would that be any different? So that's kind of like my lens, because I think it's just a lot of like reflecting too, like what Eric mentioned earlier, like there's going to be a bajillion problems out there, but maybe it's not you to solve every problem out there, or like any particular, like there's certain problems that you're not a good fit for, but the problem that I'm tackling or the problems I have tackled I knew that I was a good fit for. So I think it's kind of like a founder problem fit. I don't know if that's like a phrase, but I think that that's also something that has been a big part of like my journey too. And also it has added to my own personal confidence of being able to build something new and create something that is innovative.
One thing, the second part of your question, I think you had asked also, you mentioned like this brick by brick concept. Like one thing that I also would urge, and I don't know if you're a founder, Carson, or thinking about getting started, but one of the things that I do when I talk to other startups that are a little bit behind us in terms of timeline and journey is that you want to make sure that you're not over engineering, right? A lot of times people want to take this like concept of build it and they will come. And that is really the hardest thing to do. So I always challenge people, especially at the earliest stages, like, do you really need to build that? Or is there a way for, again, to you to experiment, test something as cheaply and as scrappy as possible so that you can get the data and understand, okay, I think I'm onto something. And when you do, then you use that data to inform kind of what you build next. Like, what does that V1 look like? And I just have to stress how important it is to think about things in versions, in phases. What is that crawl? What is that walk? What is that run? And really, really kind of push to test things as quickly and as cheaply as possible so that you are not building and acquiring a lot of this technical debt that is really, can get really expensive.
And that's such a powerful way to test your own assumptions too, right? I mean, both of you talked about how, you know, you came at this from your own perspective and your own lived history or your own kind of selected history, and you come with your own perspective. And so what a better way to test your assumptions and test your own knowledge base than, first of all, talking to people, like you said, Dana, like really kind of doing that user research, but then building it in fragments. And if something doesn't line up with how you were assuming, questioning that, saying, oh, okay, look, what's actually happening here? And then building on, as you're saying, Eric, the data. Hi, Melissa. Great to see you.
Hi, David. I wanted to chime in and just say I have zero, well, I shouldn't say zero ideas. I always have a quadrillion ideas floating around in my head, and listening to the two of you talk today is pretty darn inspiring. So thanks for coming on and sharing not only your successes, but the challenges you faced. It's really helpful for us all to hear stories. We like storytelling. So thanks.
Yeah, seriously, it's been really, really helpful and motivating, inspiring. I don't know. I definitely resonate with you, Eric, of having imposter syndrome, and for you, Dana, something that I can definitely learn from you is trying to understand like my own strengths and how that can help me fix a few problems in this world. And it really comes down to what both of y'all said, is like knowing yourself and playing to those strengths. And just by virtue of those two things, you know, confidence can naturally like come up through that. As for like the position I'm in right now, it's I have enough for a few provisional patents and I just need to seek funding. So this is where like confidence comes in and pitching. So yeah, your advice has been incredibly helpful. So thank you.
That's great, Carson. Best of luck with that. That's really exciting to hear. All right, well, we have about 5 minutes left. So I'll pass it off to each of you. I guess where you are now, what would you tell yourself when you were first beginning, when you just had that initial idea? Whichever one of you wants to go first.
Yeah, I can go. I mean, Eric kind of mentioned it a little bit earlier, is that think of how you can test your idea as quickly as possible in the most cost-effective way. I think that, a lot of people who go into building a new company, they think, especially a tech startup, they think, okay, I have an idea. I'm just going to build, like, I'm going to hire a developer and like build out the tech solution, which is costly, number one. Number two, I can like 100% guarantee you that you're not going to use it. And also it will change. So it's kind of one of those like assumptions that people think that you have to go after because you're building a tech startup, you need the tech. But there's so many other ways to actually manually test what you are trying to solve. And, you know, I actually listened to this or read this story about Lug, which is the company that like moves, helps people move. And what they did was they waited in a parking lot and asked people, hey, would you pay somebody to help you move this couch into your new home or whatever it is? And most people would say yes. And they would, you know, put on their hat, bring out their truck and just drive it and showcase from that, just those data points of just sitting around waiting for people without the actual tech shows that, hey, now if we add tech, it can help and you know what to build. So yeah, I think that like continuing to really think about like how you can test it manually, quickly, and cheap. I think that's the best thing to do when you are thinking of a new startup.
Thank you.
Yeah, I think I'll take a different approach here. What I would love to tell myself when I first started this was just a reminder that, you know, there's a lot of allure around being an entrepreneur and startup world and venture capital funding. Kind of have to divorce the idea that it's always like that. It's a life of peaks and valleys, right? There's days where you're celebrating your wins, and then there's days where you're like, I don't know if I'm going to have money in the bank because, you know, there was a run on the bank, for example. Like, and those are the kinds of things that really kind of test your commitment and your perseverance. Being a startup entrepreneur is hard. It's really hard, and having the right support systems in place are really important at the family level, at the professional level, at the friend social level. Those things are really important. And I know a lot of founders that are dealing with a lot of mental health issues because there's just a lot of uncertainty right now. And so just making sure that, you know, people go into this. I know I wouldn't have changed anything about my journey at this point, but I would certainly would have really appreciated the reminder that, you know, building a company from the ground up, that 0 to 1 phase that Dana talked about is difficult. And sometimes things aren't always going to go as planned. But you got to take care of yourself. Like, got to make sure you fill your cup, especially if you're working on anything that has like any kind of social impact. You got to fill your cup before you can fill other people's cups. So definitely would emphasize just commitment, perseverance, and support systems to support people at this early stage, which can be really stressful.
Thank you both. If people have follow-up questions, I'll just give a chance for you guys to plug your websites or socials or whatever you want to do. How can people learn more about CHLA Health and Wander Health?
Yeah, so we're live. We're seeing patients in California. We have a large population in Southern California that's using our service. If anybody on this call wants to try it, doesn't matter if you're Latino or not, wants to try CHLA Health and just take a more proactive role in your healthcare, if you send me a message, I'll put my email here. I will give you free access for 3 months. Just give it a try. And I'm happy to answer any questions. But just send me an email. I'll get you set up with an introductory appointment, 3 months free, and prioritize your health because it's really important. You got to be healthy.
That's awesome. I am going to add my website here. We're currently looking for beta users, especially if you plan to travel to Mexico this year. We're actually offering, we're waiving the membership fee and we're offering 50% off services. So you can actually book your urgent care appointment if you needed it, or an IV drip if you're abroad and you had a good night or a fun night than before. We are looking for beta users here. So just go ahead and sign up and then we'll send an email.
Wonderful. Well, thank you both so much. Just to echo people who said it before, this is so useful for all of us to learn, especially those of us who have, nascent ideas that are trying to figure out what's the next step. So really, really appreciate you sharing the peaks and the valleys and allowing us all to learn from everything that you've done so far. So congratulations, guys, both of you. It's great to see you again, and have a great rest of your day, everyone on the call.
Thanks so much. Appreciate it. Good luck, everybody.
Thank you all.
Thanks, y'all.
Okay.